All right, October is Breast Cancer Awareness Month, a time to educate ourselves on symptoms to look out for and when to get screened.
Dr. Wendy McDonald joins us now to share more. And, you know, Dr. Wendy, a lot of people think I'm really only at a high risk if I have a family history. But that's not the case.
That's not the case. 1 in 8 women will be affected by breast cancer, and a significant proportion of them will not have a family history or a personal history. I mean, obviously, there are things that we can do to reduce our own risk of breast cancer, like making sure we're exercising, we're keeping, tabs on our weight, we're not drinking alcohol a lot, we're eating good fruits and vegetables, and just trying to take care of our bodies. But it really does come down to sometimes just a random hit, like that it'll just get you.
Right. And there's so many different types of screening, and to keep all the recommendations on the age, it all kind of is murky waters if you're not staying on top of it every day.
For sure. It doesn't help that the different screening bodies give us different guidance.
Right.
The United States Preventative Task Force has a different guideline than the American Cancer Society. ACOG, which is the American College of Obstetrics and Gynecology, which is who I'm involved with, they say that you can start screening at 40 and you can screen every year. Some insurances will even cover a screening mammogram at 35, especially if there's a family history. But I tell my patients, hey, it's better to screen because you're going to find things, God forbid you never find something, right? But you're going to find something typically on a mammogram that you wouldn't even have felt yet. So better to look and screen every year starting at 40 than to wait until 45 or 50. You're going to miss a significant proportion of people who will get breast cancer.
Self-breast exams still recommended?
Still recommended. I can't tell you how many people have found their own lump and come to me and say, hey, what's this? And sometimes when I feel it, I'm either concerned or not, but I've sent people for imaging, and sometimes even the lumps I'm not concerned about turn out to be cancer. So absolutely check them out. The guidelines changed to not do self-breast exams, or some guidelines said don't do self-breast exams because some people will find things that are not cancer, right? You can find a cyst, you can find a lump that's not concerning, but you're going to find some things that are concerning. So as long as you can kind of keep your peace of mind that if I find something, it's not necessarily cancer, as long as you can keep that kind of level head, I still think it's important to check yourself.
And then there comes the case, a lot of ladies have dense boobies, right? And so there's multiple levels of screening you can do, and I know now a lot of insurance covers all of it, but some of them don't, and like, what do you do?
Yeah, so actually this year, kind of an exciting development that now mammograms have to report your breast density. So what is breast density? Let's back up. The connective tissue in our breast, what holds our breasts together, is kind of what can be seen as density on a mammogram. The fat on mammogram is going to look dark, black. Connective tissue is going to look white. Cancer also looks white. So if you have a lot of connective tissue in your breast, more connective tissue than fat, or just kind of a larger percentage there, it's going to be flagged as dense. Well, a mammogram is not going to catch as many cancers in that case. So you may qualify for, say, an ultrasound or an MRI. But it is important for us to get the screening to even determine if we have dense breasts. Lord, that's a tongue twister. But because you can't necessarily feel it yourself, but the imaging will tell you.
So if you do find out you have dense breasts,
yes,
should you automatically just go for MRIs or for ultrasounds?
The challenge is what's insurance going to cover, right? So even now with the new guidelines to say if a person's breasts are dense on mammogram, it doesn't necessarily mean that an MRI or an ultrasound will be covered. We're moving and trying to push toward coverage of that additional imaging. But I think it's still important for us to know what our breasts are looking like on the inside. Maybe you actually want to use your HSA and get a little bit of extra imaging. I mean, I think that to me is a better thing than catching a late breast cancer, better trade-off.
Well, and if your doctor reports that you have dense breast tissue and puts a request in for an MRI, is there a possibility that your insurance will pick it up?
There's a possibility, but insurance as well as I do. You know what I mean? It's a fight to the finish, but we try, and I think it's worth advocating. I definitely advocate for my patients who have dense breasts, who've had a history of repeat imaging. If they can get additional imaging from the beginning, great, but it is still kind of a fight.
And then, so is it still once a year if you don't find anything, or do they spread it out once every 2 years, 3 years? I mean,
again, back to the guidelines. Some will say you can do them every other year. ACOG says every year is acceptable. And to me, acceptable means go ahead and get it done. You know what I mean? Like, that's good enough for me.
Okay, and then why does it stop at 75?
It doesn't have to.
Okay, is it just
I think it's because
possible?
I mean, honestly, a lot of these guidelines are like, well, you're going to die from something else by the time you die from breast cancer. I'm telling you, that's what some of them come down to. Like even like stopping PAPs after 75. I still do PAPs on my 80-year-olds, on my 85-year-olds. We still catch uterine cancer. I'm still ordering mammograms on my 80-year-olds, and a lot of times Medicare will cover a mammogram on an 80-year-old. Why not screen?
Yeah.
All right. So you got a little rap.
Oh yeah. Cue my music. It's a little bit of a, you know how we do. We
Yes.
try to bring it up to speed. Smiling through the pain even when they're pressing on me. Mammal pressing down, still no cancer speakers on me. Wait, I know I was gonna mess it up. It's okay, it's all right. Smiling through the pain even when they're pressing on me. Mammal pressing down, still no cancer screeches on me. Very least I'm gonna do the most. Better press, stop waiting for the growth. Hold Dr. Winter, hold the mic. It's today didn't do it. That's okay. That's okay. That's okay. I knew my nerves were gonna get me. I know.
A lot of people don't go because they're like, oh, it hurts.
Right.
It hurts so bad. But
Yeah.
It takes like 10 minutes
It does.
max.
It's better to get that than to get breast cancer, in my
right?
opinion.
Ooh,
Surgery,
there you go.
too? Yeah, no way.
pick your poison, folks. Hey, Wendy Goodall McDonald, MD. There's the phone number, social media handles, as well as the website so you can make an appointment to get in to see her.
Yes.
Dr. Wendy, thank you so
Thank you,
much.
Dr.
Thank you so much.